Sekarang kita di Phuket Plastik Surgery Institute, tempat bisa melakukan berbagai prosedur plastik surgery dan wellness bersama dengan para dokter-dokter yang ahli dan terkenal di seluruh dunia. Bersama dengan dokter-dokter ahli dari PPSI, ada dokter Sanguan, ada dokter Pong Saton, ada dokter Wiria di sini, direktur dari PPSI. Kita semua menyambut klien-klien dari Indonesia untuk datang ke PPSI Thailand di Phuket.
As everyone knows, as our team focus is the patient safety. That's the priority of our institute, and all the surgeons, all the staff here must stick to this patient safety principle, because all of our surgeons are members of International Society of Aesthetic Plastic Surgery, or ISAP. So we have very careful to select the patient, that the patient must be healthy. If they have some underlying disease, it must be in good control before proceed with surgery. Every patient before surgery must undergo all pre-operative measurement, blood test, chest X-ray, EKG, and the history of the medical history, underlying disease, allergy, which kind of medicine they take regularly. That's happened before they came.
Yeah.
So we know in advance that who is a good candidate, who have any risk and can go with surgery or not. If they're good enough, for sure, when they are here, after our screening test, they can proceed. But if we doubt, before they came, we will be in communication until we have a final decision that, okay, you're fit for surgery or not. If you're fit, you fly. If not, you take care of yourself at home. The good candidate must be healthy in terms of physical health and also emotional health. They must be steady, realistic, reasonable, not very high expectation. We need to manage the expectation a lot. So, age of the patient, the minimal age of the patient who fit for aesthetic plastic surgery must be over 20 years old in Thailand. They mature at 20, but in some country I know the people who's over 18 is legal maturity, but it's better for us to consider the patient who over 20 years old. But in case of necessity, if they under 20, between 18 to 80, we need the guardian permission. That one thing. And then, even they're very old, even my patient who's almost 80, but if there is indication and we think that it's worth to do and discuss properly, we can do it. We can do it. So we need to see the expectation of the patient toward the surgical procedure that they decide is realistic or not, is get along with or not. Some patient is very fat, very obese. They like to have a slim body by liposuction. That's not possible. We need to explain and let them reduce or lose weight until it's aligned with the guideline, the BMI low until it's good to proceed with surgery, then we will do it. Otherwise, we will not. I was trained by Dr. Prisha Tirthanon. That's 30 years old in Chulalongkorn Hospital. He's a pioneer of this surgery in Asia, in Southeast Asia, in Thailand. So very fortunate that I learned a lot from him, and then developed my own practice, my own technique, until today. So the question is, who fit to this surgery?
Yeah.
Sure that every candidate must follow the guidelines set by the BIPAC, or World Professional of Transgender Healthcare Association.
Okay.
They have many criteria, such for example, they must show some desire to live in another gender. Like if they are man, they like to live as a woman, they need to show this desire for a period of time, 1 year, 2 years.
Okay.
They need to be under hormone replacement therapy, such as if they want to be a woman, they need to be under female hormone for a period of time, 6 months. They need to be screened or evaluated by the psychiatrist or psychologist to confirm that they are a good candidate. They have no psychotic disease that make them feel like
impulsive.
Yes, that they want, actually they are not. Something like this. And if they pass all the guidelines or the criteria, they send the certificate to us to make sure that they're good candidate. Then we accept to do surgery for them. And they must be over 20 years old.
Okay.
But if they between 18 to 20 and have a good indication, we need a permission from the guardian, like that. And when they come to Phuket, we advise them to stay in this island for at least 3 weeks.
3 weeks.
Mostly almost 2 weeks in the hospital and another week at the hotel until the last follow-up. If we positive that they safe, no complication, they can return home and then follow our guideline to take care of themselves, especially how to keep the new vagina function or open by regular vaginal dilation. And very fortunate that all of our patients have a successful surgery and can return home without serious complication. There might be some minor complication, but it's manageable. And it's not a big issue, like a wound problem that can heal secondarily, or if they take care well or something like that. But they can go back and behave like a woman, and we issue the certificate for them that they already have all the surgery, and then they can apply to have the gender identity change or even birth certificate change at home according to the law of that country.
Thank you very much, Dr. Sanguan. And maybe in the future we will have more questions and discussions with you again.
Yes, I'm very glad to work with you, and hope that we will have the patient from Indonesia to come to Phuket and not to only enjoy our scenery, sunset, sea, but also have a good surgical outcome before they return home.
Thank you very much. Kak Paket and Ling Sehat is always happy to work with PPSI.
ครับ สวัสดีครับ
Sawadee.